In the name of God, most merciful, most compassionate, good afternoon. I would like to start with reiterating and stressing that the government is keen on being transparent and on sharing transparent, accurate information to the public and citizens, and that any incident of exaggeration or causing panic and disinformation shall be dealt with as per the provisions of the law, and the persons behind it shall be held accountable. Having said so, Petra News Agency has apologized for the wrong information it published about the number of COVID-19 cases today, which was shared by one of its correspondents in the field, noting that the current situation gives no room for mistakes and disinformation, and anybody who causes this shall be held accountable. In the light of the approval of the Ministers' Council on the guidelines of restoring business at public departments and institutions as of Tuesday, May the 26th of 2020, the Prime Ministry today shared and circulated the guidelines among all ministries, public departments, and institutions. The guidelines aim at preparing workers to go back to work and to take the precautionary and safety measures needed, and also to sustain the delivery of services to citizens on site or remotely. Jordan, in fact, is the first country among the program of support in governance and management, SIGMA, the first country that developed guidelines for the reopening of work at public departments after 2 months and a half of partial lockdown because of the repercussions of COVID-19. Amongst the most important features of the guidelines in relation to reactivating work at the public departments are the following: gradual rejoining of staff members to the workplace. That will be divided over 3 batches, taking into consideration the percentages that will be decided by the competent minister and according to the decisions taken in the light of the changes in the epidemiological situation. Complete adherence to the instructions by the Ministry of Health and competent authorities in relation to methods of prevention, including physical distances and wearing masks and gloves. Implementing regular disinfecting and sterilization for the place. Also limiting the meetings and conferences that require physical presence, replacing them with audio-video meetings and teleconferences to the extent possible, noting that physical meetings should have the minimum number of participants needed and ensuring that there is safe physical distances between them. Limiting the use of paper-based documents, replacing them with electronic-based documents. Also, designating areas where customers are to be received, noting that they shouldn't be allowed into the building back offices or internal facilities, and also the hours during which they are to be received shall be defined. Limiting the use of cash-based money and replacing that with e-payments and e-wallets. Activating sterilizations, conducting sterilizations, disinfecting measures at the door and the doors and gateways of the public departments, and also processes of taking temperature of the workers as they get in. Noting that some staff members are excluded from the obligation to go back to their work, including those with medical history, with immunity problems, pregnant workers and nursing mothers, workers who abode in areas where there is a spread in the infection, contacts of COVID-19 cases, and those who have special circumstances that preclude their joining the workplace. For example, they have children who have nobody else to take care of them, or because there is no transportation available, these can work remotely. Flexible working system is going to be implemented, especially for the workers who are most vulnerable for the infection, and also for workers who need to stay at home because of other reasons, such as taking care of their family members or the elderly. The guidelines also organize how to deal with customers in service departments, like how to organize the queue, deciding the safe physical distances, and also all other precautionary measures. And we'd like to urge all of our colleagues, the civil servants, to read the details of the published guidelines. We have it posted on the website of the Prime Ministry, and shortly after this briefing, we're going to publish a detailed news item with the content of this guidelines. It's going to be on the different media outlets and on our official media platforms. We've been receiving multiple questions as to the method through which we're going to receive the applications of children of Jordanian women and those who bear provisional passports, their application to be repatriated into the kingdom, and the COVID-19 crisis cell stresses that they can communicate with the embassies in their respective countries, and they can file their application through these embassies. The Ministry of Foreign and Expatriate Affairs is going to reactivate the electronic platform safelyhome.gov.jo for those who were not able to register previously, the Jordanians who were not able to previously register, or those who are bearers of Jordanian provisional passports, or the children of Jordanian women. They can register now. Some are asking us if the businesses are allowed to operate and open on the first day of Eid. In fact, this day is more of a comprehensive lockdown that we implement every Friday. However, people are allowed out of their houses on foot only. Therefore, businesses and commercial stores are not allowed to operate on this day. May God bless you, bless this country and its leadership. May God protect you, your loved ones, and the whole humanity from this pandemic. We're at your service and we succeed if you comply. Thank you very much. Good afternoon. Today is the International Nursing Day. And in the context of this pandemic, in fact, the most wonderful quote I found is that of Her Royal Highness Princess Muna Al-Hussein, the founder of nursing in Jordan. She says, "You have earned the title of the White Army. You have earned the trust of His Majesty and that of the Jordanian people. Happy International Nurses Day." And unquote. And I quote her in again, "If you don't bring love and appreciation to the patient, then I don't think that the treatment is working," unquote. And I say, you did in fact bring all the love and appreciation and sacrifice to us. So to you, my colleagues, children, sisters and brothers, the nurses, registered nurses, you have all of our appreciation and love. Today in the kingdom, we had 14 COVID-19 cases. The thing that makes the total number of cases 576, distributed as follows. 5 are contacts of the lorry driver of Mafraq Al-Khanasri. 2 of them are children. They were with their mother at the hospital, and both are under 5. 3 cases are for students at the Dead Sea. They came from the United States. 3 are for lorry drivers at Al-Amiri border post. They bear Arab nationalities. We've dealt with them as per the protocol. They were not allowed into the kingdom. And I would like to mention, some are asking me, why do we count these figures as Jordanian figures? In fact, as per the instructions of the WHO, any case diagnosed on the country's territories should be diagnosed and should be counted amongst its numbers. There have been 3 cases in Al-Zarqa. Now we are inspecting and tracing the infection. The Director of Health in Zarqa, in coordination with the Governor of Health in the Governor of Zarqa, are instructed to trace the cases and to define if there are any infection areas and isolate them. There have been no recoveries today. However, thank God there have been no deaths. Therefore, the number of patients under treatment is 122 patients. 4,500 tests were conducted today. Therefore, the total number of lab samples pulled since the very beginning is 123,600 tests. May God protect you, protect this country and its